Good afternoon, and thank you for joining us this afternoon. We'll be starting the webinar shortly. While everyone logs on, please make use of the chat function and let us know what site you're from and which state you're in. Good afternoon again and welcome. My name's Lisa Yates and I'm the Queensland Stroke Link Coordinator here at the Stroke Foundation. I'd like to introduce our presenter for today, Lex Bull, who is Stroke Foundation's Stroke Link Coordinator for Tasmania. If you haven't already, it might be helpful to have a copy of my stroke journey close by to look at during the presentation, but if you don't, that's not a problem. Before we begin, I'll briefly run through some housekeeping. An interactive webinar is a good webinar. We encourage you to use the Q&A function at the bottom of your screen to submit your questions as you think of them, or you can also use the chat function. If you see a question that someone else has asked and you also want answered, you can use the thumbs up button under the question to vote for it. There will be opportunities for interactions and discussions throughout the session, and we encourage you to participate in these. All registrants will receive an email with the resources mentioned in today's session. At the end of the session, there will also be a short survey where you can also register for a CPD certificate. The survey will close in 1 week, so if you'd like a CPD certificate, I really encourage you to fill it out as soon as you can. Stroke Foundation respectfully acknowledges the traditional owners and custodians of country throughout Australia and acknowledges their continuing connection to land, water, sky and community. We pay our respect to the peoples, cultures and elders past and present, for they hold memories, cultures and hope for their peoples. I would like to acknowledge that I'm joining you today from the lands of the Turrbal people in Brisbane. I'll now hand over to Lex to begin the presentation.
Thanks, Lisa, and hello to everyone. I'm coming today from Nipaluna, Hobart, and the lands of the Muwinina people. And today, really, all we want to achieve is for you and your teams to have a really clear understanding of how the My Stroke Journey resource works and how it can be used by all the members of your team in the discharge care planning process to ensure you best meet your clinical care standards, the clinical guidelines, and best support stroke survivors. I think universally across the nation, delivering quality health and care plan information on discharge has proven to be a real challenge. And we want to make it as easy as possible for clinicians to deliver it and as useful as possible for stroke survivors. So at the Stroke Foundation, ultimately our aim is that My Stroke Journey, the resource, will be delivered to every stroke patient every time across the nation. We know that stroke happens in an instant. We know that the impact of stroke is highly individual and often complex and profound. And we know that with the right treatment at the right time, many people can recover from stroke. I think for most of us, we've been immersed in stroke care for years, and sometimes our whole working life, has revolved around stroke. It can be easy to fall into the trap of thinking that everyone understands stroke. The reality, though, is that when you first meet a stroke patient, not only are they still reeling from one of the most traumatic experiences they've had in their life, but it's also likely that they have little or no understanding of stroke, and they have little or no understanding of the healthcare system that they're in. So we need high quality information and good support to be able to actively participate in their treatment and rehab and to reduce their risk of stroke and to help them live well after stroke. Stroke education, discharge planning and secondary prevention help stroke survivors to access the services they need to live well after stroke. Our primary education resource for stroke survivors is the My Stroke Journey booklet. It was introduced back in 2013 and was a collaborative effort by hospital health professionals and consumers and the Stroke Foundation to drive improvement in information delivery. We recently undertook a review of the resource and we've now updated My Stroke Journey to the version you can see on the screen. There are lots of different versions. There's My Stroke Journey Classic, there's an Easy English, the Our Stroke Journey for Aboriginal and Torres Strait Islanders in the blue and green artwork cover, and the Our Family Stroke Journey with the cover with a family photo. All contain the same important stroke information, just in different formats, and to help stroke survivors transition from hospital and rehabilitation to home and on to recovery. And we'll include a link to each of these in an email we'll send out after the webinar. The My Stroke Journey suite covers everything from diagnosis and early testing and treatment, all the way through to having family meetings, getting ready for discharge, and it shares other stroke survivors' experiences as well. So it's now more user-friendly with all the care planning pages where you can write personalised information for the patient at the front of the book. There are two versions of this, the Easy English and the Classic. The Easy English will suit most patients, and the Classic version is there for patients looking for more in-depth information. And we've talked about it before, every person, every time is the motto that we have. The one exception to this would be patients who are heading down a palliative pathway. It's always really good for us to have an idea of how well our services are doing. And the Stroke Foundation audits of acute and rehab services are a good indication of where we are in relation to providing comprehensive discharge care planning in Australia. And we're looking at the 2021 information here. And the 2021 acute audit identified that nationally, 24% of patients didn't receive a discharge care plan, and 22% missed stroke risk factor education. And the rehab audit going back another year to 2020 had similar figures, with 22% of rehab patients not receiving a discharge care plan and 37% missing out on stroke risk factor education for behaviour change modification. This is national data. And I'm sure a lot of you know that up to 80% of strokes can be prevented. I'm not sure if everyone knows that, for every stroke patient you see, there's a 43% risk that they're going to have another stroke in the next 10 years. So I think that stat alone shines a pretty big light on why we need to ensure all of our patients are as enabled as possible when they leave our services. Along with making sure patients get the information that they need, the My Stroke Journey helps you and your service to meet both the clinical guidelines and the clinical care standards as well. The clinical care guidelines recommend a documented post-discharge care plan is developed in collaboration with the stroke survivor and their family, and then provided to them for reference. I think this is a mark that many services regularly miss. We know that locally developed stroke-specific information and referral to a local support group is independently associated with higher discharge quality scores, with fewer unmet needs at 6 months post-stroke. You're looking at some of that information now. This evidence also supports the use of secondary prevention medication following stroke, but inadequate information about medication uses and side effects is associated with poor medication compliance, adverse drug reactions, and poorer outcomes. So Andrews and others in 2018 identified that although most people were given information on community services and equipment, only about half of those who required services received active assistance to organise their supports. Funding arrangements, multiple providers, service availability, and restrictive eligibility criteria mean that if patients are not actively linked to the services as part of their transition to home, they'll often not access them at all. Generic information doesn't prepare patients for return home, which is why you're able to provide them and tailor My Stroke Journey for every patient, every time. The quality of discharge care planning was inversely associated with the reported number of unmet needs and positively related to quality of life post-discharge. The need for provision of a personalised care plan is also recognised and recommended in the clinical care standards for stroke, produced by the Australian Commission on Safety and Quality in Healthcare, Quality Statement 7 is about providing patients with the information they need so they can successfully transition from hospital to home. This individualised care plan is provided to the patient before they leave hospital and includes rehab goals, lifestyle modifications and medicines to manage risk factors, equipment, follow-up appointments, contact details for ongoing support in the community. And all of these elements can be met by using My Stroke Journey. In fact, the standard specifically identifies that My Stroke Journey covers all of the essential elements of a patient care plan. So how do you as health professionals use My Stroke Journey with your patients to create a comprehensive and individualised care plan? Well, the first step is to implement the use of My Stroke Journey by your team in your site. To ensure every patient receives a My Stroke Journey every time you have a stroke admission, it's important that you have plans and processes in place, even backup plans for when key people aren't available. We're keen now just to get some information from you. At the Stroke Foundation, we want to know who's delivering My Stroke Journey at your site. So I'm wondering if you could take a moment when you're online, give me some respite from my voice and let us know in the chat which clinician it is in your team that provides the My Stroke Journey. And I'll just give you a minute while we get some of that data back.
Just checking there, Lex, and it doesn't look like we've had any responses yet. We'd love to hear from you, though, about who's providing that at your site.
So my experience has been often it's the stroke CNC, but I have seen models where other people do it, but we'd love to know. Every site's different. Okay, got a few coming through here now, Lex. So Brett Stewart, thanks Brett, so the stroke coordinator. Kristen Rowe from the Austin said the stroke liaison nurses. We're in the process of trying to engage nursing staff as missing the weekends and when they are not there. I think that's something that is a common occurrence across many sites there, Kristen. Juliet says mainly the stroke liaison nurse and sometimes the allied health team members also provide education and the MSJ packages as well. Natalie from the PA hospital in Brisbane said the nurses. And Emma from Baringa Private Hospital said sadly no one uses it at their hospital. Okay. Thanks for all your responses, guys. It's good to know what's happening. And if you're not using it, we're really glad we've got you here today to talk about it. Yeah, that's great. Thanks. That's really good to know. And super challenging, you know, to get this information, not just to the patients, but to have a really clear process about how you do it. You know, it's a challenge that every site faces. And we know that the hospital space is ever challenging and it's ever changing. And in the previous conversations we've had with teams like yours, these are the sort of difficulties that we've found, you know, everyone's having in delivering quality information to every patient. So this is feedback from stroke units around the nation. And it sounds like we're hearing that now today as well. When you take the time to get processes in place, though, as these guys did, you find that often there are solutions to these. And the same people that we worked with and we heard those problems with found creative solutions. And I guess what we would say is if you're having trouble finding solutions and implementing processes at your hospital for My Stroke Journey, get in touch with us so we can help make sure that you know, you can embed these processes. These are some of the great kind of workarounds that sites found for these barriers. So if you do have a copy in front of you, this might be a good time to get out your copy of My Stroke Journey so we can help go through them together. And it's not a problem if you don't. And you'll see that there's two main components: the general information about stroke and the care planning pages, where information can be patient specific. And for those of you with a copy of My Stroke Journey, if you turn to page 6 and 7 in your books, you'll see there's a table of contents, and it's the easiest way to navigate around My Stroke Journey and to see where the care plan pages are located at a quick glance. The sections are all color-coded and they correspond with the colors on the edges of the My Stroke Journey booklet. And you'll see it's broken into sections. There's My Stroke and Recovery, What is a Stroke, How will my stroke change me, Rehabilitation, Reduce your risk of stroke, Getting ready to leave hospital, Getting help at home, and then the Strokeosaurus at the back. For your services to meet the care standards and clinical guidelines and provide the best care possible, the following sections need to be completed with personalised information in consultation with the patients and their carers. So there's sections around My Stroke on page 8, My Hospital Team, My Risk Factors, My Leaving the Hospital Checklist, My Questions and My Goals, and How My Stroke Will Change Me, and the Reduce Your Risk of Stroke. I think previously there's been some suggestion that My Stroke Journey isn't an adequate discharge care plan. And I think that's often the kicker here, is that it needs to be individualised for every patient. And if by completing these sections you do that, you've currently got a quality discharge care plan in your hands for the patients. So to walk you through a little bit, the first care plan page here on page 8 allows you to start the conversation about the diagnosis of stroke. So don't forget to talk about the cause in terms of risk factors, why there was a blockage or why there was a bleed. It can be a great way of personalising the information for your patients. And the feedback we get from Strokeline is that we're often referring people back who can't remember the type of stroke that they've had to this page, so they can go back and understand how stroke works. On page 9, My Stroke Team allows a space for each team member to add their name and contact details next to their role. And I think it's really important that discharge care planning is the responsibility of the entire multidisciplinary team, not just the one person. So in sites where we find everyone's reaching for the My Stroke Journey when they meet the patient, then no one's going to be missing out on this valuable resource. And this is especially true in the current staffing climate that we're experiencing across Australia. So page 10 and 11 look at My Stroke risk factors. It's also a great reminder to add in fact sheets and have important discussions around the management of individual specific risk factors post-stroke. Fact sheets can be ordered at the same online location as My Stroke Journey or downloaded immediately for printing from the Stroke Foundation website. And one of the significant messages we strongly encourage you to reinforce is making sure your patients know the signs of stroke, the FAST message, and to call 000 in the event of signs of a secondary stroke. Page 12 has My Leaving Hospital Checklist. And this starts the discussion around what happens when a patient leaves hospital or the rehabilitation service. Information that should be included here includes outpatient arrangements, appointments to see their GP, and community rehab services. My Questions and Goals is a great page for patients to fill out themselves in conjunction with you, their stroke team. It can be used for inpatient goals, or it can be used for setting goals to achieve post-discharge. And supporting this page is the online goal setting portal on Enable Me, where there are videos and step-by-step support to set goals, make plans, and track progress. There's also a reminder on this page about the support available through Strokeline for goal setting. And for those of you who don't know, Strokeline is our confidential helpline and is available from Monday to Friday, 9 to 5. It's available to stroke survivors, their families and friends, and also for you as health professionals for secondary consultation. We'll be having another webinar on our Stroke Foundation resources during Stroke Week. So make sure you register and come along to find out more about what the Stroke Foundation provides if some of these terms and support systems are new to you. So 24 through 37 talks about how will my stroke change me, and it ticks another part of the individualised care plan. So these pages address common changes post-stroke, like communication, fatigue, and personality, and help provide some framework for you to discuss the specifics of these with a stroke survivor, as well as prompting the need for additional fact sheets to delve deeper into these areas. Then pages 44 through 54 talk about reducing your risk of stroke. So research highlights that risk factors and secondary stroke prevention education needs to commence in the acute setting for best outcomes. And these pages provide some framework for you to highlight and discuss individual risk factors, how to minimise risk of secondary stroke, as well as prompt the delivery of additional information in the form of fact sheets. Now, I've talked about the fact sheets, but within My Stroke Journey, you'll find a full list of the available fact sheets on page 63. So I wonder how your site documents care plans and the use of My Stroke Journey. You know, the very final pillar in good process for delivering My Stroke Journey and providing quality care plans on discharge is the appropriate documentation of its completion. And again, as I mentioned earlier, if it's proving challenging, please reach out to the Stroke Foundation, and we have some examples of how these are being developed by sites, documentation examples, to make sure that you have these processes embedded. So to summarise, once you're familiar with the document, using My Stroke Journey with your patients is really straightforward. The most important things to remember is the booklet needs to stay with the patient in the hospital, and your team need to include the patient in care planning. You need to document in the medical record that you've provided it. So when it comes to audit time, you can confidently say you've provided patient education and care planning. Remember, if you don't document it, your great work goes unmeasured and unrecorded. And here are just a few tips, simple tips to improve the effectiveness at your site. My Stroke Journey, Classic and Easy English, Our Stroke Journey and Our Family Stroke Journey are all available for immediate download as a PDF, as are the fact sheets from the Stroke Foundation website, or you can order a hard copy from the Stroke Foundation website as well. We're translating My Stroke Journey into 8 community languages and have just released My Stroke Journey Italian. It's available to order from the online store now, and you can view the content and download the PDF from the website. My Stroke Journey Arabic, Cantonese, Greek, Hindi, Mandarin, Korean, and Vietnamese will all be released by the end of this year. Stroke survivors, their families and carers, and you as health practitioners will continue to be supported online through the Enable Me platform and by Stroke Line. And of course, the Stroke Link coordinators in your state or territory are always available. By making My Stroke Journey more accessible than ever before, with your help, we can focus on 100% of stroke patients receiving the support and individualised care planning that My Stroke Journey provides. Every patient, every time. So I've talked a little bit about the Stroke Link coordinators being there to help you in your state, and making sure you reach out if they can help you with your processes or planning. It's a pretty quick webinar today, but we've got a little bit of time for some questions. If anyone has any questions they'd like to ask, and I'll throw back to Lisa to finish up for us.
Thanks, Lex. We just had a comment earlier regarding the documentation of the completion of My Stroke Journey. So Juliet said we have a pre-completed note based on the MSG format to document provision of stroke education. We have a gap in demonstrating in our documentation that the appropriate care plan sections have been completed though. So that's a really good start to have a template that staff can use, particularly if you've got electronic medical records, just in terms of making it a bit more efficient. But good to recognise there's some gaps and always opportunity to improve, I think, across many sites.
And I've seen those pro formas adapted by sites as well, Lisa, where they've gone from, you know, a simple tick box from My Stroke Journey being delivered to adding extra boxes that say, you know, stroke factor risk, you know, risk factors discussed, you know, tick. So you can break that down into more check boxes with the same concept in mind, that make sure that we're delivering everything that we need to.
And I know that some sites as well also have a drop-down box section. So you can actually say, I've discussed these risk factors, and just select the ones that are relevant to your patient. So just depends on which system you're using at your site. Is there any other questions from anyone? No, it doesn't look like it. Okay, well, if there's no further questions, we might leave it there for today. Thank you, Lex, for the very informative presentation. It's a lot to get through, but it's a really great resource. So I really encourage you to use it for your patients. Just a reminder that everyone will receive an email with links to the resources we've discussed today. And you should now, in your browser, a survey should have popped up. We really encourage you to complete that. We really value your feedback on this webinar series, and you can also register for a CPD certificate there. So the survey will close next Wednesday. So if you want your CPD certificate, please complete it prior to then. And we also encourage you to sign up for our mailing list if you want to hear about what other webinars we have coming up. We do have webinars running every day during Stroke Week, which is in 2 weeks' time. So get on and have a look on Informe as to what's coming up for those. So thanks again for your attendance, and thanks, Lex, for the presentation. We look forward to seeing you again next time.
Great.
Have a good afternoon.